Mr. Speaker, I rise today to express my gratitude to the many volunteers from Ohio's 3rd Congressional District who are here this week representing the American Cancer Society Cancer Action Network. They are working tirelessly to help end cancer for everyone. Over 750 volunteers, advocates, and patients from across the country representing almost every congressional district, including constituents from my 3rd Congressional District of Ohio. They are selflessly donating their time and energy to fight to end cancer. Mr. Speaker, approximately 1,680 Americans die every day from cancer. Ohio alone, there will be almost 24,000 cancer-related deaths this year, putting Ohio in the 6th highest mortality rate in the country. These numbers are staggering, and they serve as a sobering reminder that nearly all of us have had a friend or a family member to fight this disease. Just 2 months ago, in this very chamber, we grieved the loss of my dear friend and our Congresswoman and colleague, Sheila Jackson Lee, who sadly passed after her courageous battle with pancreatic cancer. One of the biggest existing hurdles to beating cancer is our limited ability to detect it early. That is why the American Cancer Society Cancer Action Network volunteers from Ohio are here advocating for increased funding for cancer prevention and research for the passage of H.R. 2407, the Nancy Gardner Sewell Medicare Multi-Cancer Early Detection Screening Act. This bill is led by my friend and our colleague, Congresswoman Sewell. She would like to increase access to earlier and simpler cancer screening. Early detection delivers hope, especially for Black Americans who face the highest cancer death rate and the shortest survival rate of any racial or ethnic group in the United States. We must do better to understand cancer and to serve our underserved communities. We must work together because working together will ensure that all Americans have equitable access to new cancer detection tools. Mr. Speaker, we have had many spirited debates on this floor. But with the over 2 million new cancer cases expected in 2024, I think we can all agree on a shared goal to fight and to beat cancer. One way of starting this would be for us to pass H.R. 2407. And that is why I want to thank the Cancer Society for their advocacy, and also to let us know that they are the arm of the Cancer Society. And they are the leading organization urging increased funding for cancer research and cancer prevention. I also want to take this opportunity to thank and commend ACS-CAN's Board of Directors Chair, Dr. Kimberly Jeffries Leonard. Dr. Jeffries Leonard is a trailblazer with over 40 years of experience in applied health and behavioral medicine research. She made history in becoming ACS-ANC's first Black chairwoman. Congratulations to you, Dr. Jeffries Leonard. This exemplary organization has made it possible for us to meet our constituents, to hear the stories, and to understand better how cancer burdens families, far too many families. And lastly, Mr. Speaker, I would like to say that it is important for us as members of Congress to support investments in cancer research and innovation that will help prevent, detect, and treat the families and the individuals with this disease. So, Mr. Speaker, let me once again thank ACS, CAN, and their volunteers for their tireless dedication and diligence in the fight against cancer. Thank you, Mr. Speaker, and I yield back.